Good morning, everyone. I am Moreda Ismael M. Taloza, a first-year student of nursing at University of Cagayan Valley. Currently, one of our subject is fundamentals in nursing, and our topic is nursing as a profession. So I am here to interview a registered nurse.
Before we begin, kindly introduce yourself to us, ma'am. Okay, so thank you. So good morning, everyone. I am Kathleen K. Taloza. I am 25 years old and I am a registered nurse and a licensed professional teacher. So I graduated my bachelor's degree of nursing at University of Cagayan Valley last 2016 and passed my board exam right after the graduation. And then I took up my certificate program for teachers education last 2017, and then after the earning my units, so again I passed my board exams for the board examination for licensed professional teachers. So currently I am connected at Department of Social Welfare and Development Field Office 2 as a Project Development Officer 3 and designated as the lead secretariat wherein I am in charge of the sectoral services of the DSWD or the social services wherein I am tasked to deliver services or activities with regards to persons with disabilities, OFWs or the Overseas Filipino Workers, children services, children protective services, women, family, and trafficking. Thank you for introducing yourself to us, ma'am. So I have questions here for you to answer. So my first question, ma'am, is why do you want to be a nurse? Okay, so actually, when I was enrolling for nursing, I didn't want to become a nurse by that time, but then one of the staff in charge during the enrollment told us that nursing is a very good profession. You can use nursing anywhere you go. So with that, I was convinced to enroll nursing. So a goals of nurses, registered nurses. I think we have more than 10 nurses in the family. So that's why I pursue nursing. I see them how they work hard, how they sacrifice their life, or how they do their job with very good effort, and um, that would be the that is my inspiration why I that is one of my inspiration why I pursue nursing. So what or who influences you to become a nurse, ma'am? Aside from this staff during the enrollment who told me that nursing is a very good profession, very inspiring profession. Of course, my family, and by that time, nursing is very boom. So what I mean is that there are many registered nurses at that time. But then in my time, we are only few. Actually, we are only 9 who graduated in our batch. We are only 9 that time when I graduated. So, and then, um, of course, the salary by that time is very inspiring. So that would be one of my, that would be one of the factors that influenced me to pursue nursing. And of course, the number one is that the services I would like to give in our community, especially that we are living in the third world country, and as you can see on in the public hospitals. So, may i-inspire ka talaga na maging nurse pag nakita mo yung mga pasyenteng nakakaawa or less fortunate that they cannot afford to go on a private hospital. So, yun. Um, madali kasi akong maawa. So, parang yun yung isa sa mga drive ko why I want to become a nurse. Next, ma'am, is how do you view nursing? How do you view nursing? course, nursing is like a hero. Nursing is like an angel because in nursing, um, it is not only it is not only the brain that you are using. Hindi lang yung pagiging matalino ang kailangan mo sa nursing, but the most important is your love, your heart, how to care for the others. Especially, sabi ko nga kanina that we are living in a third world country, that many Filipinos only seek hospitalizations or saka lang nila iindahin yung kanilang health pag malala na. So, as a nurse, yun na lang yung tanging maibibigay mo. If you cannot give financially, so at least your care would be enough para sa mga nangangailangan ng iyong tulong, especially the sick persons.
So, what qualities of a nurse you holds dearly, ma'am?
For now, since I am in DSWD, I don't do my work institutionally, which is in the hospitals or clinics or something that you are holding as a range. But before I was promoted with the lead secretariat, which is my current job. So I've been into disaster management, and one of the that I am very proud of that na napag-aralan ko sa nursing or quality ng nursing na hanggang ngayon ay dala-dala ko is that being aggressive. Aggressive in a way na positive, not negative. Aggressive being mabilis yung pag-iisip mo, mabilis yung galaw mo, because in disaster management, you are not only dealing with sick people, but you are dealing how to save also the lives of the affected communities, affected families or individuals. So, also, yun yung isa sa mga favorite subject ko sa nursing, which is the disaster nursing. So, nagamit ko talaga yung napag-aralan ko sa disaster nursing sa naging work ko na sa disaster management. Aside from that, yung how to use the triage. So, we have triage in hospital. So, in disaster management, you can also use the triage. You will prioritize who will you save first, what intervention are you going to give first to the affected communities or families. So, that characteristics really is, I think, habang buhay kong dadalhin habang nagtatrabaho ako.
So, ma'am, how do you maintain your profession kahit na nagtatrabaho ka ngayon sa DSWD na instead is hospital?
Okay, so medyo mahirap yung question. But now, since so I am currently connected at DSWD, so DSWD yan yung mother agency ng mga social workers. But mind you, there are so many nurses in the department, especially those in the communities, assigned in the communities, which is yun yung mga tinatawag naming municipal links. They are in charge of the 40s because, again, mind you, nurses are very flexible. So, we have community organizing. So, in community health nurses, so we have community organizing. So, yun yung mga isa sa mga ginagamit ko while I am at the SWD, community organizing, because you deal with the community, the affected communities, the individuals that need social services or assistance. And then aside from that, since we are still on the pandemic, so nurses or other healthcare practitioners are very in demand. So in our work, in my workplace, so we have this so-called COVID-19 support team. So we nurses in the field office are in charge in the contact tracing of infected staff in COVID-19. Aside from that, I also do first aid. And first aid in my workplace dahil may mga construction workers po sa aming workplace. and then being the first aid team during mass gatherings na activities ng aming agency, which is yung mga distribution of assistance. So one time nga, we have a beneficiary unfortunately died dahil na heart attack during the distribution. So I am one of the responders during that time. And then yun, we do also health teachings to our colleagues. So yun na lang yung aking mga activities being a nurse sa aking workplace.
The next question, ma'am, is how have nurses contributed to the public image of the profession?
Okay, so as I have told you a while ago that nursing is a very good profession. You would really love nursing. So I actually, my brother and sister are currently in the nursing field, or they are, my brother is a fourth year nursing and my sister is a first year nursing student. So if they are lucky enough to graduate, so we are tatlo lang kaming magkakapatid, but tatlo din kaming nurses. So the image of
Nursing in public.
in the public nurses contributions to the public as a profession is that in this time of pandemic, we all know that nurses are very, very helpful in the para malutas yung COVID-19. Nurses are the contact tracers. They also do the swabbing for the infected patients. They are the one caring for the patients, and those nurses that are assigned in like the SWD, government non-institutional, are very important. So yung pagiging flexible, magaling ng nurses is one of the best qualities that tatatak sa mga tao. And then yung pagiging when you
Hear a word nursing, ang agad maiisip ng mga tao is that you can be consulted in about health, about medical, and yung pagiging maalagain. So I think that would be the image, very good image that nurses contributed to the profession.
Ma'am, paano maiko-correct yung mga sabi-sabi na ang nurses daw ay katulong lang ng doktor?
Paano ma-correct? So, I would like to tell everyone that nurses are very good in assessing. That is one of my, yung panlaban ko sa work ko ngayon, that nurses do assess before giving services, before giving intervention. So, the work of a nurse is not katulong of a doctor, but instead it is they are the partners of the doctors. They are the one in charge for the assessment. So kung wala yung assessment, walang intervention, hindi makaka-diagnose ang doctor. They are the one caring for the patient. So aside from that, the care that they are giving to the patients are based on science. They are research-based. So, hindi lang, sabi ko kanina, hindi lang utak din ang ginagamit, but puso. But in here, hindi lang puso din ang ginagamit, hindi utak. So, when you pursue nursing, you don't, hindi lang 1,000 questions ang inaabangan mong examine yearly. More than that, because every exam, more than 100 na multiple choice na situational ang prepare ng mga clinical instructors para masanay ang mga nurses. Aside from that, the board exam of nurses is 2 days. So, other professions only 1 day sa kanilang board exams, but in nursing, you have 2 days for the board exam. So, I don't agree with that mga sinasabi ng mga nagmamagaling na
Mamamayan.
Mamamayan. No, significant others. So, nursing is one of the difficult course that anyone can pursue.
Next one, ma'am, is why is the image of nursing important to the profession? Because nurses is one of the best
Profession, you are a professional, so kailangan mong alagaan yung pagiging nurse mo. All the characteristics of a good person, of a good nurse should be maintained because we are living in the Philippines, everyone is judgmental. So, you have to be careful in everything that you do na lahat na ipapakita mo. So, kailangan mong maging careful kahit na nilalait ka na, kahit na pine-question nila yung pinag-aralan mo versus sa nabasa nila sa Google, nabasa nila sa Facebook, versus sa ginawa ng lola nila na intervention. You have to maintain your professional attitude. You have to understand them. Since ikaw yung nakakaintindi, you know the process, you know the mechanism, you know how nursing works or the medical field works. So, intindihin mo na lang
Ikaw
sila.
ang mag-adjust para sa kanila.
Yes.
So, next is, what lifelong learning strategies should you pursue to grow and develop in nursing?
Actually, I don't. For now, I think I don't see myself as a nurse working in the hospital. But I still love nursing. I am very proud that I am a nurse. I am the only nurse in our division in the disaster management before. But then, since I moved to the protective services division, so I think we are only less than 10 in the division because our division has centers, the Center for the Children in conflict with the law, so we have nurses there. The Center for the Children Study and Reception, so we also have nurses there, and the Regional Haven for Women and Girls, so we have also one nurses there, and in our crisis intervention unit, and me in the sectoral. So for now, I don't think that I am taking my next level of nursing, but yun, I am very proud that I am nurses, and I would just like to add that actually last 2020 I started to process my NCLEX since my aunt is in the US and she wanted me to go there and work as a nurse, but then here comes COVID, so naantala at hanggang ngayon hindi ko pa siya naitutuloy. And yun, kailangan mo din mag-work sa hospital bago ka rin makapunta ng ibang bansa. And considering sa Philippines, buti nga at naipasa na natin yung law that na sundin yung nasa Philippine Nurses Law na ang entry salary ng nurses ay SG-15 sa government, but then ang hirap din pumasok, medyo mahirap, hindi ko nilalahat din pumasok sa government, so you have to muna sa private, which is hindi ganon kaganda ang sahod, I think. as per observation and as per yun, kwentuhan with my friends as nurses in private hospitals. So, I opted to continue my career na lang muna sa DSWD.
So, what is the future of nursing as a profession?
What is the future of nursing as a profession? So, with this time of pandemic, may mga nakita akong mga memes that sabi ni Florence Nightingale, Mother of Modern Nursing, if I am not mistaken, dahil yun nga, hindi ko na na-practice ang nursing, na makikita ang importance ng nurses in the year 2000s, after how many
After
BC?
20 years.
20 years or more than that, after century pa nga ata yun. So, Yun, ngayon nakikita na natin yung importance ng nurses. Though, yun nga, yung sabi ko, before nag-boom ang, so dati yun, di ba, nag-boom ang nursing, then biglang bumagsak, which is yung batch namin, 9 lang kami graduate again. But then, here comes after that, after 5 years, nagkaroon tayo ng pandemic, and that nakikita mo yung importance ng nurses, ng nursing profession, and with that, I think tuloy-tuloy na maging maganda yung na hindi na bababa yung mga enrollees natin later on ng nurses, dahil ngayon pataas na naman ng pataas, dahil kailangan ang nurses, dahil ang nurses ay hindi lang yung sick ang kanilang mga client, kundi pati the well people, which is they are the one of their main tasks is that they have to promote wellness, they have to promote health instead of yung nag-aalaga ka ng may sakit. So, that's it.
Next one, ma'am, is what are the factors impacting on the nursing profession?
Factors impacting on the nursing
Nursing.
profession.
So actually, there are so many factors that impact the nursing profession. But then I would like to localize it in the Philippines, which is in this time of pandemic. I would say that one of the factors would be we are tagged as modern heroes by carrying we are the frontliners, we are the ones who cares for the patients infected by this virus. Aside from that, we are the ones who are giving the vaccines. And then, really, I would say that aside from those activities or events that nurses are that you could see that that nurses are very important, is that and those that would be one of the factors. Also, for nowadays, dahil na naman sa COVID, we are very much thankful to our government that finally the entry salary for nurses in the government is salary grade 15. So, we also wish na ganun din sana sa mga private hospitals, dahil ang hirap maging nurse. Wala kang weekends, hindi mo pwedeng piliin yung day off mo. So, yun, we are very much thankful sa ating government for approving the request of many Filipino nurses. And aside from that, nurses in abroad have a great salary. So, that would be, I think that would be one of the
Factors, what are the biggest challenges facing nursing today?
Today, again, since we are in pandemic, of course, that is the trend, that is the current issue. So, one would be the one biggest challenge that I see is that overloaded ang work ng nurses since they are the frontliners. Nasa checkpoint, may mga nurses na nasa checkpoint, may mga nurses din na nasa rescue operations. And then, yung pinaka-biggest is that stigma about the COVID. Yung kinakatakutan kanila porket nag-work ka sa hospital na akala nila ay virus ka na or infected ka na sa virus, which is hindi mo naman ginusto, ginawa mo lang yung trabaho mo, but then pinandidirian ka ng mga tao, iniiwasan ka. So, that would be one of the biggest challenge dahil nakaka-apekto din ito sa mental health mo and your well-being. So, how can you continue your work? Paano ka mai-inspire kung may iniisip ka like that, pinandidirian ka? So, paano mo magagampanan yung work mo kung may mga taong makikid ang utak, hindi nakakaintindi, na instead of thanking them, they are bashing them, pinandidirian or kinakatakutan. So,
that would be the one of the biggest challenge that I see. So that would be all.
It is not part of the questionnaire, but I am curious the reason behind your working at the SWD as PDO3 instead of nursing the hospital.
Okay, so that is a really, really hard question. Nakaka-pressure. Okay, so before I answer that question, I would like to share you a short story about how I ended up at the SWD. Actually, when I was waiting for the result of the board exam, which is ilang days yon. Kasi konti lang, not like before that umaabot pa ata ng 3 months. But parang na-bore ako. So I ended up enrolling CPTE kasi 18 units lang yon. And after one sem, pwede ka nang mag-board exam at mayroon ka ng another license. So parang naengganyo ako doon. So, at that time, then here comes the result of the board exam. Luckily, I passed. Then, I inquired at Simple Hospital by that time kasi parang yun yung training ground dito sa Region 2 when it comes to experiences of nurses. Yun. So, sabi nung isang nag-interview sa akin, nabanggit ko kasi that I am taking my certificate program for teachers education. Then sabi niya, how can you do the hospital duty when you are studying? Eh, by that time, my schedule is after 5 o'clock and my I think the schedule at the hospital would be 7 to 3. So, I think I can juggle with it naman. But then, pinapili ako nung nag-interview sa akin if I would, kung anong pipiliin ko, if the nursing, the training in nursing or the CPTE. So, since nakalahati ko na noon yung STEM, so, ang pinili ko yung CPTE. So, yun, hindi ko na tinuloy yung sa nursing. So, yun, tinapos ko yung education and then luckily I passed the board exam. Then nag-volunteer ako ng Red Cross. So, really, I didn't go to hospital. I don't have hospital experience aside from my internship when I was studying. So, pumunta ako sa Red Cross, nag-volunteer. Ayan. So, by that time, we have a project of the Lawin livelihood. So, disaster management. So, my work experience would be more on disaster management. Ngayon lang na iba. So, actually, 2 days pa lang ako sa aking work as a lead secretariat. So, yun, as a nurse, nagamit ko naman yung napag-aralan ko sa aking current work, which is
The therapeutic communication, ayan, I would like to share. Therapeutic communication is very important, which is napag-aralan yun during the 3rd year. Disaster nursing, hindi sa literal na yung kagaya ng disaster management, but then yung concepts kung i-apply mo siya sa work in managing disaster is magagamit mo yung napag-aralan mo as a nurse. And then, yun. And the real reason why I am now working at the SWD because I am the breadwinner, I am the panganay in the family. So I have to work hard, I have to find a job that compensate me well so that I can help my brother and sister which is also studying nursing. So you know the tuition fee of nursing. Kaya ako nakapagtapos ng nursing because of my aunt. Yan, siya ang tumulong sa akin. Kaya ako nakapagtapos ng nursing. And now, of course, hindi naman pwedeng pabayaan ko yung mga kapatid ko. So, I have to work in an agency or employer that gives well compensation, and yun, and I really love, though I love nursing, then nagamit ko naman siya sa aking work. So, that would be the main reason why I am at DSWD.
So, thank you, ma'am, for your time, and actually, we're magkapatid kami.
And why are you crying? You look like you're crying with my last answer. Bye.